Morning. I am Dr. Malik. Another important variety of fever, another important variant of fever, which we see in this season, in this rainy season, is gastroenteritis with fever. Gastroenteritis with fever. That means the patient had some food infections or some water infection. He must have taken some outside water or outside food which is contaminated, so it can occur to a whole area in one area, or it can be an endemic. Once upon a time, long back, we used to call it cholera, where infection in the food by Vibrio cholera. There is one organism called Vibrio cholera. We used to call this as cholera. Patients, a group of patients used to have severe in one area, from one area where the water is infected or food is infected. The mainly it comes through water. So they used to have severe pain in the abdomen and continuous loose motions with fever. We used to call it cholera. In my childhood. Later we used to call it food poisoning. Later we used to call it food poisoning. Now we are calling it gastroenteritis. Usually it manifests within 24 hours. This gastroenteritis, after consuming some outside food or infected water or contaminated water, usually contaminated with some drainage or some other, or stored food, because of stored food. So this occurs within 24 hours after the consumption of food or water, and it presents with severe abdominal pain, cramps, and loose motions, continuous loose motions, just loose motions. So very important is stomach pain, loose motions are characterized, and within 24 hours after taking food, this can manifest anytime. Usually, if it is mild, fever, it also comes with fever. It also manifests with fever. So usually, if it is mild, you can manage with small medications like ORS, like just like electrol. You can just give one spoon of electrol in one glass of water and go on giving the patient as long as the loose motions are there. And sucrol syrup is just like Digene or Gelusil. It is antacid syrup. You give it 4 spoons. You give him little more quantity, 4 spoons each time, 3 to 4 times a day. And ORS is a must. ORS, or you can give coconut water. ORS is nothing but electrol, which we call it. So pantoprazole plus domperidone, it's a must. Pantoprazole tablet with domperidone, we call it PAN-D. Please give a tablet of PAN-D. And antibiotic is a must. Ofloxacin with ornidazole. Oflox OZ is the correct tablet. Ofloxacin with ornidazole. This combination, you give one tablet in the morning, one tablet in the evening for minimum 2 to 3 days. And cyclopam is the tablet to control pain and fever, stomach pain and fever. It is paracetamol with dicyclamine. Cyclopam is the tablet which controls pain and fever, stomach pain and fever. And to control the motions, we give loperamide, that is tablet Andial, and capsule Redotil. To control the motions, we give tablet loperamide, that is Andial, or it is available in other forms also. It is called loperamide. We give Andial and capsule Redotil, Redotil. These two are very effective in controlling the motions. So this is how you manage. Sometimes with this management, if the patient is having vomitings also, so the patient will not be able to give anything to the patient, and the patient will be deteriorating. Please immediately admit the patient in local hospital, because he is going into dehydration and sepsis. So he has to be admitted. Once this fails, you have to admit in hospital. There they give IV fluids and injection monosef, that is ceftriaxone. They give IV fluids, injection monosef, that is injection ceftriaxone 1 gram morning evening, and injection metrogel. They give 100 ml of metrogel 3 times daily, and injection mecacin also is given. Injection mecacin IV morning evening. So this is usually the management in the hospital, and IV fluids will be given. Usually the patient recovers. But sometimes the patient deteriorates. Sometimes the patient will become serious. They deteriorate because the infection may be serious. He may go into sepsis. In fact, they do stool culture, stool examination, and they do routine investigations like CBP. How much is the infection? How much is the white cell count? WBC, white cell count, how much is it? If it is very high, they go for higher antibiotics. Suppose the patient is not improving with this medication, next there may be fall in the urine output. The urine output falls, and slowly the kidney damage will occur. Kidney damage can occur. Then you have to do serum creatinine, one blood test called serum creatinine, if the urine output is coming down. If the serum creatinine is little high, definitely there is some damage to the kidney because of severe loose motions and sepsis, and basically the BP also will be low. Because he is losing plenty of fluids. Then IV fluids, along with that, to maintain the BP, we give noradrenaline infusion. Noradrenaline is an iotrop. To maintain the BP, we give noradrenaline infusion, and life support with, sometimes if the oxygen is low, if the oxygen saturation is low, life support with ventilator can be given. And if the patient is good, the serum creatinine is raising and the kidney function is coming down, there is shutdown, renal shutdown, or kidney function is damaged, you go for dialysis also. And at that time, the higher antibiotics like meropenem can be resorted. Injection meropenem is given at that time. Higher antibiotics will go for injection meropenem. See, this is how food poisoning, this is how gastroenteritis is treated. Gastroenteritis is not a small thing. It can start as mild and proceed up to dialysis and all. So it is very, very important. We cannot ignore or neglect gastroenteritis. It's a very serious entity. It should be taken very seriously. And one more important thing is, there is one thing called chemical poisoning. In gastroenteritis, it is because of infection. But there is one more condition which mimics gastroenteritis, is chemical poisoning. For example, if the food has got some chemical, if the food which they have consumed has got some chemical, for example, they cook in big vessels. In marriages and all, they cook in big vessels, and while taking out the food, if any the metal which has burnt, if it produces any chemical metal, some metal also comes out while taking out the food. If some infected material contains some chemical inside, it comes from the vessel which they are cooking. That chemical comes out from the vessel. It is called chemical poisoning. The food has got some chemical which comes from the cooked utensil, that particular pot, or that particular utensil which they are cooking. Chemical can come from that, and that is called chemical poisoning. In this case, if there is chemical poisoning, there is no infection in this. It's only chemical poisoning. There won't be any loose motions. There will be severe vomitings. Within 6 hours. This is very, very important. Chemical poisoning manifests within 6 hours of taking food. No motions, only severe vomitings. There also the treatment is same. And patient must be admitted to the hospital, because sometimes the patient can deteriorate very fast. Sometimes the patient can deteriorate very fast because of the chemical. He goes into very fast, acute, severe vomitings, and the patient deteriorates very fast. So please, as early as possible. This is called chemical poisoning, which occurs within 6 hours of taking food, whereas this is gastroenteritis, which is because of infection, which can manifest within 24 hours anytime. So this is important. This is only vomitings. Chemical poisoning, only vomitings, but severe vomitings, uncontrolled vomitings, we have to admit the patient, and the treatment is the same, and the same thing, dialysis and all, everything is the same. So ultimately the patient care will be the same, because it is very difficult to differentiate between gastroenteritis and chemical poisoning. Not easy. Only thing is, this manifests very fast, this can manifest little late. That's the only thing. So be cautious about this thing. Very